focus on good news when you can try and invent something to make people angry instead? Why make lemonade when you can just suck on lemons?
The problem with Obamacare isn't, as Republicans say, that not enough people are signing up. It's that too many people are going to sign up, and we're going to have another entitlement program that we can't afford.
Joining me now is the president of Demos, Heather McGhee, and vice provost at the University of Pennsylvania and author of Reinventing American Healthcare, Dr. Zeke Emanuel. Dr. Zeke, let me start with you. First, It was night terrors about death spirals, and now it's too many people are signing up for this. Are Republicans ever going to be satisfied when it comes to the ACA?
Yeah, I think they're going to be satisfied when we finish the next election, and it probably isn't going to be that big an issue, and it's probably going to blow up on them. Remember, part of the problem the Republicans have with the Affordable Care Act is it really is their plan, and they don't like the fact that the Democrats actually agreed with them. This should be a bipartisan plan. It's a private marketplace where private companies compete. As the insurance company executive said, there's no government takeover of our companies. We're competing in a marketplace, and the government's helping people get insurance, and all of that should be good news for the country. So I think we're seeing increased desperation. We saw a lot of rhetoric before the law was implemented, the exchanges were implemented. We're seeing increased desperation because while it's not working perfectly, it's actually working reasonably well, as you pointed out, and that makes it hard to run against it.
It's working reasonably well, especially given all the obstacles that Republicans have put in the way. I mean, we're not just talking about Republican governors who have not expanded Medicaid, but also the 50 repeal attempts, the attempts at defunding. I thought the hearing yesterday, Heather, was quietly devastating. It was quiet because there were no cameras rolling, but devastating because here were insurance executives, the business guys, brought in to kind of reveal the dramatic failures of the ACA. And not only did they not do that, they basically gave the law a shot in the arm, especially on the subject of who has paid their premiums, which has been a major GOP talking point. 4 of the 5 insurance executives said, oh, actually 80% of the people that have enrolled have paid their premiums.
Right. And I think what the Republicans were trying to do there was paint the beneficiaries of this law as sort of deadbeats, right? I mean, so it's like, why did this become a talking point?
That's
you have to pull
the whole
that
narrative,
back, right? It's like they're deadbeats. They're people who don't pay their bills. They're going to be trying to mooch off the system. And it's just so much antipathy these people have for their fellow Americans. It's sort of always shocking to me.
Zeke, you said the law is not perfect. And I wonder at this point what most concerns you. Certainly the obstacle course is not finished. One of the questions I had when we got the latest data about the enrollment numbers is that the young invincibles, people 18 to 34, make up 28% of enrollees. That is lower than the initial figure of, I think, 40% that the White House wanted. Of course, we don't know whether or not young enrollees are all healthy and how many people signed up are actually healthy, and that will truly determine what happens to premiums. Go ahead.
Actually, Alex, I don't focus on the young enrollees. The real 2 big challenges. One is to really get the website working very well. As I said, the standard ought to be Zappos or REI or whatever your favorite commercial e-commerce website is. That's where we've got to get it working, both at the front end and at the back end. And we need, insurance products have to improve all the time. That is going to be important to give this thing real life and to make people want to go there. People want affordable health insurance, and we have to give them products and the ease of shopping. So that's one thing that I think should be very high on Burwell's agenda. And the other is we have seen an uptick in healthcare inflation in the last 2 quarters. And I think that's worrisome, and that actually needs real attention. And there the big issue is to get Medicare to begin changing its payment formula off the fee-for-service method onto more capitation or bundle payments or some other mode. And that, I think, that's harder to do, but that really needs attention if we're going to tame the healthcare inflation beast and make sure that health insurance is affordable long into the future and that the federal deficits are under control. So those would be my 2 big agenda items to really proceed over the next few years.
I don't know that I get to have agenda items, but if I did, Heather, one of my agenda items would be shaming the Republican governors who have refused to expand Medicaid. There are 5 million low-income Americans who live in states where Medicaid has not been expanded. There are new studies out, and I think this is something that Democrats and people in support of the ACA should be hammering over and over again. Rejecting that expansion could kill 6,000 Americans every year. There is a mortality rate that you can draw a direct line to from the provision to not expand Medicaid.
Shockingly, when people can't afford to go to the doctor, they get sick and they die. Like Charlene Dill, a young woman who was a mother of 3, working 3 jobs, and was unable to get the heart medication she needed because Governor Rick Scott denied her care. This idea that these public servants are actually allowing partisan politics to cause the illness and death of their constituents is something that we've been accepting for a long time by being a nation without health care, and we said in a way across the country that we were going to end that. We were going to sort of move this country into a more civilized state, and the fact that these governors in 24 states are still allowing that to happen, basically free money that could save their constituents' lives, it's just unthinkable.
Well, I think
So
go ahead, Zeke.
Could I chime in? So in the 2012 election, the Republicans frequently said, you know, no one died because they didn't have health insurance. Well, this study that was recently published in the Annals of Internal Medicine, and actually a lot of data that we had in the past about people who didn't have health insurance and got into accidents, or people who didn't have health insurance and got cancer, had shown that, in fact, not having insurance was associated with worse health outcomes, including higher mortality rates. That statement that if you don't have insurance, you can still go to the emergency room and no one dies is simply false, and it's no longer plausible to make that argument. And I do think that you're going to see after the 2014 election a lot more states come on and look for that money because their hospitals want the money, because they are providing this care regardless of what people's insurance status is. And we all know that if we can improve people's health before they get sick, we can actually begin to, if not save money, then at least not spend as much in a very poorly targeted way.
What I do, the true irony here is that study about mortality rates linked to Medicaid expansion or lack thereof is based on a Massachusetts study of what? Romney Care. It all comes back to the Republican Party. Heather McGhee and Zeke Emanuel, thank you both for your time.
Thanks.
Moments ago.